So I just want to respond to one thing that you brought up on the Office of the Health Insurance Commissioner, that many of us in the Senate are both, as our roles as senators and personally, some of us know and are familiar with many of the people in the Office of the Health Insurance Commissioner.
Yes, she's brilliant.
And I can honestly tell you that knowing them and how they feel about their roles, that nothing would make them happier than to see their office no longer needed because there was a single payer system.
Yes, I'm sorry if I implied that they personally are against single payer. I do feel that they're hamstrung.
I don't know if they're for single payer, but I know they would feel it to be
worthy of
completion of their mission if there were no health insurance enforcement necessity.
Understood. It just is a problem for them to keep financial structurally.
Chairman, if I could
Yeah.
I don't think their mission is to prevent I think they're out looking for the consumer. I think they're trying to protect the consumer from, say, Blue Cross or United Health going bankrupt overnight, and you wake up the next morning and I think that is what it means by their primary role.
No,
I don't think it means how you implied it, that they're trying to keep these businesses going. I think it's just the opposite.
Well, I do think that they do. I understand what you're saying.
Yeah, you see what I'm saying?
Yes, I absolutely
it's like,
do. But
geez, do I have a job tomorrow working in XYZ?
Yes.
But you're going to be watching to make sure that I do have that job.
Right.
And I think that's what the department is looking at, is to make sure that United Health, Blue Cross, Tufts, whoever we have in the state doesn't overnight take a walk.
Understood. So the Medicare is such a popular and successful program. It's definitely worth looking at, and they are unwilling, but they are not able to look at that because their stakeholders really prevent them from doing that.
One more comment, Mr. Chairman. Well, following along with the Medicare issue, I am a Medicare because I'm that, you see the white hair. But having said that, as a senior and knowing some seniors, they are so confused about the Medicare system because they're saying, oh, you need additional this and additional that to protect this, to protect that. So we have to fix that first.
Right, and the newly proposed federal bill, the House bill, it's called an Improved Medicare for All Act. So it would fix a lot of the problems you're talking about,
Right,
like the
because
Medicare
it should
Advantage
be
problems.
Medicare for all and
Yes.
for all things, one card.
Yes.
Not making sure that you have a whole
Yeah,
list of
Medicare
cards
Advantage
just
and
to
things.
get
Yes.
your needs, provided
Just for a
for.
second. You're right. Medicare is unnecessarily complicated. The problem stems from 2004 with the Medicare Part D law. And President Bush had the opportunity to include pharmaceutical benefits under Medicare. He chose not to. Instead, he decided it would be better to turn the pharmaceutical benefit into an opportunity for the private insurance industry to enter the Medicare co-insurance market, creating all these Medicare co-insurance plans, all of which are different, all of which are complicated. We tried to get her aunt on one of these things, and I don't think we're stupid, but trying to discern the differences between the different plans offered by different companies, it's like going into a maze. But that I don't think is the problem with Medicare. The problem is what we decided to do with it back in 2004. We could have just expanded it and made it very simple, but instead it was important for the people in power at that time to go with a market solution and have the private insurance company administer it, and it became
Mr.
very
Chair,
complicated.
I well understand that, but that's what I'm saying. We have to, because I have seniors that come to me when the end of December, October, when they have to renew what they're going to have besides Medicare, and how is it going to interact with what's coming out of their pocket. Oh, well, I have to have a $5,800, opt-out or something like that, and, or expense before this is going to kick in, or that's going to kick in. Where I believe, and I certainly believe in Medicare for all, or that we just be able to show one thing and be done with it.
Precisely.
But we have to cure that before we can bring everything else together, I think.
Yeah, hence the need for a study commission. We have to know.
Yeah, oh,
how
yeah,
can we
absolutely.
simplify this?
Yeah.
How can we make it workable, and how can we make it understandable for all these people who have their lives to live? They do not want to spend days poring over these multiple-page insurance forms, trying to figure out what they should go get, what they shouldn't get. We should just make it simplified so that they get the stuff that they need, and it's simple and it's affordable.
Yeah, and I have
No,
to
you're
agree, because
absolutely right.
most of this stuff, you need a PhD.
Oh, God,
And
yeah.
even they have a
Oh, yeah.
trouble time.
Yeah.
And thank you, Mr. Chair.
If I could add just one thing to your comment about the $5,200 deductible or the unexpected huge expense that people face when they're on limited incomes. One of the other differences between health insurance and other kinds of insurance is that if you're going to insure your home, then you buy a home in the first place which is affordable for you. And that means that your home insurance is affordable for you. But your cost of health care is something that you have no control over. So the poorest person can get the most expensive illness. And so any final solution to this problem, whether it's Medicare for all or something else, needs to accommodate that fact, which means that people's premiums need to be proportional to their income.
Thank you.
And not to the theoretical cost of health care that anybody could get. And that very fundamental problem, what it really means is that their premiums should be proportional to their income through progressive taxation. And I would argue that in the same way that we protect the health of Americans from the threat of foreign invasion through the Department of Defense established in the Constitution to be funded through progressive taxation, the writers of the Constitution didn't address health care because there was no effective health care at that time. But if they had addressed health care, I think they would have funded it the same way as we fund the Department of Defense, and they would have funded health care through progressive taxation, because the single most valuable asset in the United States is the health and energy and effectiveness of the of the population of the United States, and yet we have a sick working age population. Children are healthier in the United States. All people are healthy because they have access to Medicare. Our sickest people is our working population, and economically, that is a catastrophe for us. So your point is a good one, and the solution is progressive taxation to fund this.
One more comment, just to follow up what you're saying, and the reason is money. I have a sore tooth. I can't do anything about it because I can't afford the dentist. Then I get an abscess that goes into my jaw and I need an you know what I'm saying, it's a progression. You were talking about how the world's medical systems, well, I watch what they call ship surgeons, and they take care of a lot of the people from Africa, and they have these huge tumors. And what was the main reason they have these huge tumors? Because their population could not afford health care. Thank you, Mr. Chair.
Mr. Chair,
I'd like to-
can I just add one comment before I have the
Yeah, I just
entire...
want to give the rest of the people who signed up a chance.
Right, I don't want the entire wrath of the staff of OHIC to fall down on me.
Don't worry, they won't.
Okay, because you know I love them, they are brilliant, they are really trying to do a great job. I just want to have them be able to have as their first bullet point the possibility of looking into single payer, that is all.
Okay.